time a woman menstruates doesn't necessarily mean that she ovulates. There are things called anovulatory cycles. This means that, yeah, you're menstruating, shedding the endometrial layer, but there was no ovulation in that cycle. And PCOS is one of the, if not the commonest cause of anovulatory cycles. And overall, you want to lose some weight. It has been shown that just losing up to about 5 to 10% of body weight can help alleviate the symptoms of PCOS. So these are things that are within your control that you can do. There are also other medications that may be given. Even IVF is an option here. So there are different options, but you need to be properly evaluated by a physician. You need to speak to someone who can put you through on the options that are best for you. Hi guys, how are you doing? Hope you're well. It's me, your girl, Dr. Judith Ebengho, and I'm here today with another episode in our series on infertility. Today we're going to be talking about Polycystic Ovarian Syndrome, PCOS for short. We all know what PCOS is. In fact, if you ask people, I'm very sure that most people know, oh, they've heard about PCOS before, even if they don't know particularly about the details of what it entails. So PCOS, or Polycystic Ovarian Syndrome, it's interesting for you to know that every time a woman menstruates doesn't necessarily mean that she ovulates. There are things called anovulatory cycles. This means that, yeah, you're menstruating, shedding the endometrial layer, but there was no ovulation in that cycle. And PCOS is one of the, if not the commonest cause of anovulatory cycles. It accounts for about 70% of cases. So if 100 women have anovulatory cycles, Polycystic Ovarian Syndrome will account for 70 of those women. So that's what I mean when I say 70% of those cases. So another interesting fact about PCOS is that not everyone with Polycystic Ovarian Syndrome actually has cysts in their ovaries. So about 25% of people with Polycystic Ovarian Syndrome may not necessarily have cysts in their ovaries. This means that when you look with ultrasound, you may not find any cysts in the ovary, but they have other symptoms that are suggestive of Polycystic Ovarian Syndrome. This is important to note because a lot of people go online, Google their symptoms, or maybe you've done an ultrasound and maybe you were told, oh, there's cysts in your ovaries, and people just go online and say, oh, I have PCOS, I have PCOS. No, you do not know you have PCOS until you've been evaluated by a specialist, and then they do certain things, and if you meet the criteria, then they say, oh, you may have PCOS and stuff like that. So please do not go online looking up your symptoms. Always make sure that you speak to a professional. What are some of the symptoms of PCOS? PCOS causes menstrual irregularities, menstrual disturbances like amenorrhea. So some people may not see their period at all, that's amenorrhea, or oligomenorrhea, so they may have less or fewer periods than normal. Also, PCOS causes something known as hyperandrogenism. This is when the male hormones are in excess in the female. So everyone actually has some form of androgen, but in people with PCOS, theirs is more than it should normally be. So this is why they have hirsutism. What is hirsutism? This is when there is hair, more hair than normal on the body. So like beard, also chest hair on the chest, and all of that. That is known as hirsutism in females. Also, things like acne may be due to this excess androgens in the body. Things like male pattern of baldness, so you find people getting bald, women getting bald, and all of this may just be suggestive of hyperandrogenism like you have in PCOS. Another thing that people with PCOS may experience is weight gain, and the excess weight may also predispose them to things like insulin insensitivity. This is why they are prone to things like diabetes and stuff like that. So any of these that you find on the spectrum, you cannot just have one of the symptoms and say, oh, I have PCOS. No, you need to be properly evaluated before a diagnosis can be reached. What are some of the things that we look out for in making a diagnosis of PCOS? I've mentioned most of these things already. First, a blood test should be done. You want to check the hormone levels of the woman. You want to look out for the follicle stimulating hormone. You want to look out for the luteinizing hormone. These are things that would be looked out for if you go for an evaluation, so you don't need to worry your head about all these details. Then you want to do an ultrasound, you want to look at the ovaries, are there cysts in them and whatnot. But remember, you naturally do not have to have cysts in your ovaries before a diagnosis of PCOS can be made. It's a syndrome, which means that there are other things involved in making a diagnosis of PCOS. Also, people with PCOS have to be evaluated for signs or things that may suggest insulin resistance in them, things like diabetes and all of that, because this is part of the syndrome that makes up Polycystic Ovarian Syndrome. Down to the big one. I have PCOS, what can I do? First, you can get evaluated by a doctor, and there are different things that can be done to manage this condition. One of it is lifestyle modification, which involves your diet. We've talked about lifestyle modification a lot on this channel. Things like your diet, you want to make sure you're eating the right food, you're eating healthy, and also you want to exercise more, be physically active. You want to get in about 150 minutes of moderate intensity workout or 75 minutes of high intensity workout every week. So these are things you can be looking out for. And overall, you want to lose some weight. It has been shown that just losing up to about 5 to 10% of body weight can help alleviate the symptoms of PCOS. So these are things that are within your control that you can do. There are also other medications that may be given depending on the goal your physician is trying to achieve. So if he's trying to work on the menstrual irregularity side of things, you may be giving things like hormonal contraceptives, like combined oral contraceptive pills and all of that, just to help with the menstrual symptoms. Then also things that help with hirsutism can also be given, things that antagonize the androgen hormone and all of that. You have to speak to your doctor. You don't just go and prescribe these things for yourself. So it's worthy to mention that. So that can also be given for people that have issues with glucose control, diabetes and all of that. Medications can also be prescribed to take care of that. And for women who are trying to achieve conception, there are things that can be used to stimulate ovulation. Remember, I said PCOS causes anovulation. So there are things that can be used to stimulate ovulation. There are things that can be given to also assist this woman get pregnant. Last but not the least, fertility treatment is also an option here. Like I mentioned before, things that help stimulate ovulation. Even IVF is an option here. So there are different options, but you need to be properly evaluated by a physician. You need to speak to someone who can put you through on the options that are best for you. Couples with PCOS can still achieve conception. It is not the end of the world. Just speak to a professional and know how to go about this. Remember that this is just a part of a series that we're doing on infertility. There are more videos to come, so you definitely want to subscribe and turn on post notification. Till I come your way next time, I remain Dr. Judith Ebengho. Bye.